These are the standards. This is very important, very, very important. Now, the percentage of newborns who undergo screening by 1 month should be greater than 95% coverage, which means if a hospital is delivering 100 babies, okay, 95% of the minimum, at least 95% of the babies should have undergone hearing screening by before 1 month of age. Okay. Not more than 4% should be referred for detailed evaluation, which means among this 95% of the children, those who undergo, not more than 4% of the children should get a refer. Okay. If more than 4% of the children is getting a refer, that means there is something wrong in your hearing screening process or the protocol. Okay. Now the third, percentage of newborn who complete detailed evaluation by 3 months. Okay, should be 90%. That is, among this 4% of the people who got the refer, okay, 90% of the person in this 4% of the people who have got referral should have undergone detailed evaluation by 3 months. Okay. Now next. Now percentage of families choosing amplification by 1 month of diagnosis should be 95%. That means among this 90% of the children who are diagnosed with hearing loss, 95% of this 90% of the children, those who have diagnosed with hearing loss, should have been intervened by 1 month within the immediately after the diagnosis. So unless we meet these standards, the entire newborn hearing screening program is a failure. Okay, so but if you ask me, is it possible to meet these standards? It's definitely possible to meet these standards. Now, how long it will take? Yes, it is not going to take, it is not possible overnight. So that is what we are working, we have to establish. But I'm very positive by 6 months to 1 year of implementation of the program, we should be able to meet the standards. We will have teething issues in this country. We have a lot of things we need to modify. We need to change parameters. We need to look at the results carefully. You need skilled people to do it, but definitely it is possible to do it. It is not impossible to do it. So as I told you, types of hearing loss and test batteries, I've already explained this in detail to you. Initially, I thought I'll just project these slides, and later I thought, let me do it little elaborate so that it is very clear and very precise for you to understand. Now, this is another interesting, it's called a central auditory processing disorder. So even if you diagnose with all kinds of hearing tests, there will be another disorder called the central auditory processing disorder, where the child will have normal hearing, normal speech, but they will have difficulty in understanding speech. Okay, this is a central auditory processing disorder. If you ask me, is it possible to screen CAPDs? As it is also possible to screen CAPDs. And the different models of newborn hearing screening, you can have a universal newborn screening, or you can use a target-based screening. You only screen the high-risk babies. You can have integrated screening into the community. You can have multiple screening. There's different models of screening that you can use. There are different protocols. As I told you, 1-tier, 2-tier protocol. You can have a protocol for NICU babies. You can have a protocol for well-born babies as well. There are different protocols which we can explain. That's not a problem, but it will be a little complicated if I explain now. So to put it in a very simple term, we have to devise our own protocol. These are the protocols followed in different countries, but we have to devise our own protocols to meet the need for the country to achieve those standards, And we have to keep in mind the fund, manpower, infrastructure, inadequate support services for intervention, lack of awareness, socioeconomic status of the patient, parental attitude towards screening. Okay. Now, all these factors has to be considered when we devise a protocol for this country or to this region or to the particular hospital to meet those standards of hearing. Okay. Now, to meet this, to develop a protocol, we are very happy to help you in develop a protocol and help these people. Now, the future direction, Is it ethical to advocate for newborn hearing screening in India when the resources to provide intervention are not available? Okay, now the thing is, uh, because the follow-up diagnostic assessment and rehabilitation services are very vital component, as a hearing program alone without any follow-up services would be of little value. So that is why I've explained earlier, India has got all the potential to restore hearing. Now, what is lacking is we have to identify them yet. What is lacking is newborn hearing screening. It is definitely lacking. So, if we have a good newborn hearing screening program, imagine we can convert all the liable citizen into a potential citizen. Imagine a child who is born with hearing impairment, cannot hear, cannot speak, cannot go to normal school,